So we've entered into a new month, one where we're finding ourselves wondering could it be safe to leave our homes and when can we relax social distancing as states around the country are doing that. There are three areas that everybody is really concerned with. The first is testing. Public health opinion is that we don't have enough tests today, but that hopefully over the next several weeks to months, we will have enough testing for the fall.
You're confident you can surpass 5 million tests per day?
Oh, well, we're going to be there very soon.
Second issue of importance is vaccine development, but that is still unlikely to happen anytime soon.
When Dr. Fauci says how long until a vaccine, he says 12 months to 18 months.
And then finally, treatment options. On that front, we actually do have some very recent good news.
New findings from the NIH on the antiviral drug remdesivir.
Remdesivir. Preliminary data shows that patients who received it had a 31% faster recovery time.
So the principal finding was that this drug, remdesivir, shortened the length of stay for hospitalized patients from 15 to 11 days. While that might not sound like a lot, anything that we can do to speed up recovery can have a huge impact.
What it is proven is that a drug can block this virus.
Remdesivir works by preventing the replication of the actual coronavirus as it attaches to what we call epithelial cells. And you see those little crowns and red spikes on those pictures of the virus that are probably in all of our heads. It's a treatment that tries to prevent those spikes from reproducing the virus itself. This raises a lot of questions in the research community about what's next. Number one, if it's got such a positive signal or positive effect, should we be using it with the dozens of other therapies that are also in clinical trial? And the answer is absolutely yes, that this will be probably a foundational drug for other drugs to be tried in combination. The next question that everybody should be asking is, will there be enough of this drug so that if every American needs it, that it's available? There has already been preparation underway that the manufacturer has considered to try to have as many as 1 million doses of this drug. But beyond that, it can take anywhere from 6 months or longer to manufacture. So there could be an issue with access. Another point that I emphasized was that this is a drug that was used on hospitalized patients. Candidly, this is a drug that's administered through the IV, and you have to monitor patients pretty closely. So it's hard to imagine that this particular drug would be immediately available to be studied in the outpatient setting, but it is something that people are considering. Meanwhile, Americans are going to have to continue social distancing, hand hygiene, and doing whatever we can to minimize the spread of this virus. So that probably remains our best prevention over everything.